Hey, this is Dr. Brian McKay from Neuropathy at CoreHealth, and I want to go over diabetic foot pain. Some people also call it diabetic foot neuropathy. It's not a fun condition to have, I can tell you that much. But what happens is the feet are furthest away from the heart. So not only do you have a lack of circulation, other things come into play when you have diabetes. Okay, when you're long-standing either type 1, type 2 diabetes, the less controls your blood sugar is, the more likely you can develop foot pain or discomfort at some point. From a vascular standpoint, but also from a nerve standpoint, the sugar in the blood will eat away at the covering on the nerve, the myelin sheath, and that's how the brain communicates, is through the nerves, and the nerves has to transmit information very rapidly. So when the covering on the nerve becomes pocked or atrophies, and atrophies when it just kind of dies off a little bit due to the presence of the blood sugar or lack of vascularity, you're going to have a painful condition. But it doesn't always start out as pain. Some of the most common symptoms for diabetic foot pain is pins and needles, a tingling type of sensation, which is not, it's something you can live with, you think, but you really shouldn't. It's a lot more problematic than that because the nerve isn't working properly. Pain is a whole different animal. Pain's going to get you to respond pretty quickly, but in this case, here, tingling is really it's far more serious. When you have tingling and pins and needles. Another thing too is you can have pain as well with diabetic foot pain. That's clear. But you have increased sensitivity, or we call allodynia, AllodYnia, and that means like you're more sensitive to something. Like if someone touches you and you fly off the handle. Well, that does happen, and when it happens, it's usually not a good sign. Again, a little more serious than just pain. Pain is definitely not a good thing to have, but when you have the allodynia or the increased sensitivity, um, your brain's not getting the right information from the body part it needs it from. So that nerve is not firing properly. Now, again, another thing besides tingling, pins and needles, increased pain, increased sensitivity would be numbness or weakness. Nerves tell your brain, help tell your brain what's going on. They tell your muscles when to work, how they feel. Is it too much pressure? Is there danger? Is there damage? Now, what happens when people can't feel the things that, like if you cut your foot and you're not even aware of it? That does happen. We see it quite often with people with diabetic neuropathy. Um, they don't even know that they've got something going on in the foot. So stuff like that is a lot more serious than you think because we rely on our feet not only for mobility, but we also rely on our feet for stability. And when you lose that stability or the balance, which is something it's very insidious. You don't know you're losing balance, but all of a sudden you're walking around the house in your bare feet and you trip over a hardwood floor. Well, how the heck are you gonna trip over a hardwood floor? Well, this is how you're gonna do it. Is you're not getting that sensory input to the brain, and the brain's getting all kinds of wacky signals. So it's so be concerned. I mean, it is really something that, and a lot of times you got to work with your doctor and your podiatrist. If you got diabetes, you damn well better have, obviously your primary care doctor to monitor your insulin and your blood sugar levels, your A1C, all that good stuff. But you really need to have a podiatrist. Podiatrist is of huge importance because some stuff you can't see, maybe you can't reach, or hurts to reach your foot, and you need to make sure you're working with a good podiatrist and going at least every twice a year for to get the podiatrist to check out your feet. I mean, don't skimp. If you got Medicare, it's covered, and it should be. So now another thing I guess I really want to touch upon is your cuts and wounds heal a lot slower because your immune response is not what it could be. So your immune response is down. So when you have a cut a wound and it stays open longer, it's more likely to have an infection, and that's pretty dangerous. Infections. You don't need them. You have poor circulation. The wounds can take a lot longer to heal. If they don't heal, or you're not feeling it, you just put your socks on and you ignore it. Well, that's a serious problem. That's why, I mean, if you do notice a cut that's not healing, well, then don't wait 6 months to go to the podiatrist. I would go soon as it relates to the feet. I mean, I think you really want to go to a podiatrist specifically for the feet issues and get the care you need sooner rather than later. So, if you start to notice any unusual sensations or pain in your feet or your hands, because diabetic foot pain, is very closely related to diabetic hand pain, but it's just not as common. And the reason why I think is because the heart is so much further away from your legs than they are from your hands. Um, Something you could do for yourself is one of the most basic tests out there is you take a piece of like fishing line, a little sliver, hold it with your fingers, and rub it on your feet, or you rub on the bottom of your feet or top of your feet, and then your top of your toes as well. You should be able to feel it with your eyes closed. And if you can't, there's a good chance your neuropathy is possibly a little bit more serious than you think. And again, you want to minimize it and say, "Oh, it doesn't hurt." Well, that's good. We're glad it doesn't hurt. But the end result is you need to be aware of it, and it needs to be, so some of the things you got to look out for, I would say, is if you have dry, cracked skin. It may not sound bad, but when your skin is too dry, your risk of getting infections is a lot higher. So you could put a cream on your foot, help moisturize the toes. But dry, cracked skin is not a good thing either when you have diabetes and diabetic foot pain. Calluses is an area where the skin gets thicker and has less feeling. People with diabetes get calluses faster and more often than those without. So you may want to take the pumice stone or file it down. Take good care of it. You also go to a podiatrist. If you go to the Chinese nail salons, let them do it. Make sure they wear gloves and make sure they're safe. Um, you know, you may not want to take the calluses seriously. Ulcers are sores that happen with people in diabetes due to poor circulation. You know, any ulcer you have on the foot needs to be seen by a doctor. The longer you go without seeing a doctor, the more likely it is to become infected. And infected ulcers can spread around and cause you, in the worst case scenarios, to lose your leg or your foot. And in these cases, amputations are a very real side effect for not taking care of your foot, of the diabetic foot. You're not going to the podiatrist on a regular basis. I mean, you know, amputations are a very, very serious complication from diabetes. There's a large number of people who have amputations because of diabetes. And skin can get infected and cause the skin and the muscle tissues to die. Once that happens, it can't be fixed. So the only way is, stop the infection from continuing to spread when it's that bad. It is is the amputation. So I don't mean to scare you, but the stuff that you can do. I mean, you can check your feet. You check the bottom of your feet every morning, every night before you go to bed. Look for cuts and wounds, anything else that's unusual. These may be signs that your feet are becoming less sensitive, and that something is going on with the blood vessels in your feet. When you're at the house, wear shoes around the house, and they're really important. Keep the shoes on. It really does help. You got to follow up with your doctor. I mean, make sure you go in for foot exams at least twice a year. And if you got really bad, say you have ulcers or calluses or stuff along those lines, open wounds, go more often. You really got to pay close attention, and you want to maintain a healthy diet and exercise routine. That is of crucial importance. And if anything else too is, I mean, this is probably a common sense thing, but if you're a smoker, stop smoking. It's not good for your blood vessels. Smoking is not good for anything other than the tobacco companies. So hopefully, you've picked up a couple ideas on, how diabetic foot pain. People will take Lyrica, Cymbalta, Neurontin, Elavil. Um, Elavil doesn't really work that well. and it has a lot of side effects. It's you know, it's cheap, but it's rarely recommended anymore. Neurontin, some pain relief, but it's not a first choice. A lot of times people will go for Cymbalta and Lyrica, you know, and but there's well, first of all, Lyrica is very expensive. It does cause you to be groggy, brain fog, and Cymbalta. It's a good thing with Cymbalta. You just got to take it once a day. With Lyrica, you got to take it 2 to 3 times a day. So, Cymbalta is also antidepressive. So, depression, last thing you need is the way I look at it is last thing you need is another medication. You got to be on medication for your other issues. Um, topical stuff is lidocaine, capsaicin, and those do help. Those do help, but care for your feet. The best way you can prevent diabetes-related foot pain is by managing your diabetes as best you can. High sugar levels is what causes the nerve pain, damages the covering on the nerve, the myelin sheath. If you're already having foot pain, it's still important to manage your stuff. So talk to your doctor, discuss the proper foot care and the best treatment options for you. I'm Dr. Brian McKay, Neuropathy at CoreHealth. By working on your neuropathy, will hopefully make your feet feel a little bit better as well, as part of the course of care that we prescribe here. Neuropathy Core Health is Fairfield County's leading provider of integrative health solutions for neuropathic pain. We can be reached at 203-875-0846, 203-875-0846. I look forward to answering any of your questions. Have a great day and stay safe. Watch those feet. Thank you very much. Bye now.